Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. The theme of our Health Talk today is the respiratory syncytial virus, in other words, the RSV virus affecting our children, adults, and senior citizens, and an advice about the vaccination. Joining us today as my guest speaker is Dr. Rushdah Malik, and she's an infectious disease physician practicing in the Oakland County, and she's going to highlight our viewers about the viruses. Since she is the expertise, very happy to have her. Good morning, Rushdah, and welcome to my show.
Thank you so much. Good morning to you as well, Dr. Prasad. It's always a really delight for me to be here with you. And I think today we have a very important topic to cover. Yes. Especially in this season.
Yeah, so especially, since this is the epidemic, it's going on about, now people are not talking too much about COVID. This one has surged, COVID. So before we get started, can you just give me a short introduction to our viewers?
Yes. So I'm an infectious disease physician, and I am working in the local community, serving people in the community. I take care of acute and chronic infections, and I'm happy to be here today talk about those infections as well.
That is very good. I have heard a lot of good things about you. Anyway, so now tell me, first question, what is this RSV virus?
Yeah. So as you said, people were so centered on COVID for last 3 years.
Right,
but then what we saw in 2022, that RSV start emerging as the more common viral infection causing common colds and sniffles. And that's where people start looking into it more and more. And because the other important thing is that we do have vaccine recommendations for adults now, so I think it's really important that people know about it. RSV stands for respiratory syncytial virus. It is a single-stranded RNA virus, and it's been in the nature for a very long time.
Yeah.
History showed us that it was part of virus group that was first found in 1930s.
1930, yeah.
And chimpanzees were also diagnosed with that, and later on it was started as a human virus. It is a more common cause of childhood illness. We see a lot of kids with cough and sniffles all the time. It can cause just it's cold-like symptoms, but it can cause a severe disease, especially in older adults and young infants. And that's why we want to make, and of course, immunocompetent patient as well. We know that the season usually we start seeing RSV infection, kind of flaring up more. It start in the fall, and then it peaks in winter. So I think it's a really good time to talk about that.
Good time to talk about, So now please tell me, what are the symptoms? How I know in children with my pediatrics background, I used to see all those little infants, with the RS virus, but we didn't have immunization at that time when I was doing residency, but now things have improved so much. So can you briefly describe, the symptoms and the complications of this virus?
Right. So RSV infection can cause symptoms like sneezing, running nose, coughing, congestion. It can also cause fever, and also kids and other people can start wheezing as well. Some people end up having difficulty breathing because of that episodic cough and congestion. Now, these symptoms can come in phases. So, for example, kids can have, people who are infected with RSV virus can have some sneezing and runny nose with fever, and then it can further on go to congestion and cough and further symptoms.
Can you tell us about the high risk individuals? We will start from the infants first and babies.
Right. That's the really the depth and breadth of this severity of this virus is that it can cause severe infection at the two extreme of the ages.
Yeah.
So very young and the very old can
yeah.
get the very severe disease. When we talk about severe disease, we are talking about bronchiolitis, which is the inflammation of the lower and smaller airways of the lung.
Right.
And then we also talk about pneumonia, which is infection of the lung itself.
Right.
So when people have pneumonia or bronchiolitis, they have difficulty breathing. They have difficulty breathing to a point that they cannot eat and drink. People get dehydrated. And at the same time, when they have all these symptoms, they get sick enough that they require hospitalization. So when we talk about these two extreme of ages, who are the people who are at high risk? When we first start with infant or younger kids,
babies,
especially the premature infants, are the one who are at high risk. Then younger kids, 6 months and up to 12 months of age, are at higher risk. Now, children younger than 2 years of age, if they have chronic lung disease or heart disease, congenital heart disease, they are at high risk.
Could cystic fibrosis be one of them?
Yes. So the cystic fibrosis...
I used to see little babies, cystic fibrosis with that.
Cystic fibrosis is a chronic lung disease, and kids who have this disease, they are at higher risk. Especially they are unable to handle their secretions, clear their mucus.
So it settles.
And it causes more infection in these cases, especially in those people. They have more chances of having RSV infection, going deeper down, causing lower respiratory tract infection. Also, kids with neuromuscular disorder. Again, the whole idea is that they cannot clear their secretions, and then mucus buildup lead to further
unable to
excrete the mucus out. It can cause further lowering down of the infection, virus going deep down to the lung. When we talk about older adults, anyone who has any comorbidities, including heart disease, lung disease, including COPD and asthma, they are at higher risk. I do have a couple slides to give you a little idea that what we are looking at and what we are seeing. We know that since COVID, that was the first time when we start seeing death toll going that high with the viral illness. You see pneumococcal pneumonia also.
I was going to ask you about the pneumococcal pneumonia.
And after these two infections, now we see that RSV infection can also cause death toll up to 14,000 deaths yearly because of this disease. There are millions, more than a million people every year go to urgent care and outpatient settings for RSV infection. Also, we see that there is an increased burden of these patients who come out of the hospitalization after the RSV infection. They have cognitive deficit. They have increased burden of having loss of ability to work independently. And
So
a lot
those
of these older adults end up in the nursing home. So this is again a increased burden of the disease causing more comorbidity and loss of their healthy lifestyle.
And also, I have noticed smoking plays a significant role, right?
Exactly.
With this, we're talking about the our teenagers and adults, school, college going, who use
e-cigarettes. So what we are seeing is that people are getting more asthmatic reactive airway diseases. People are getting more asthma and coughing spells because of use of these, drugs, smoking, and vaping. And at early age, kids are having more respiratory illnesses. And anyone who has these chronic reactive airway disease, they're at high risk of getting RSV infection, and especially severe disease from RSV infection.
So you have brought some good slides. So first of all, can you explain us about those anatomy? The first one is the the virus.
Yeah,
Such a
so-
DNA and RNA. It takes me so long. It took me a long time to understand the DNA and the RNA, how the virus becomes an antigen. Okay.
Right. So it's a single-stranded RNA and a virus, and you can, just on this slide, what I want to show people is that there is an envelope protein called fusion protein, which is F protein, and that has been in a major development for vaccine that is important, that play important role in vaccination.
Fusion protein.
Next slide, please.
Okay.
This is what we were talking about, 4 major killer. What we see have a death toll higher, including SARS-CoV virus, influenza virus, and pneumococcal bacteria causing pneumococcal pneumonia, but also RSV is there as a sweeping toll of 14,000 hospitalizations and death in older adults. Next slide, please. You can see on this slide the annual burden of the disease in adults above 60 years of age, that we have around 3.4 million acute respiratory illness happening, and out of those, 1.7 million people have outpatient visits. And from those, you can see that around 177,000 people hospitalized every year. And if we look at from those people, around 8 to 14,000 deaths happening every year.
Yeah.
Which tells you that this is a very,
Very significant malignant virus.
Exactly.
Just like we say cancer, benign malignant, this is a malignant one.
Yeah, I mean, don't get me wrong, a lot of people have just common cold-like symptoms, but as I said, older adults who are above 60 years of age, and if they have other diseases, they are at higher risk. Next slide, please. So I think that's where you can see that who are the ones who have higher mortality when they looked at patients who have COPD.
COPD has the
who are
maximum.
smokers, people who have asthma, people with diabetes, also people with obesity, coronary artery disease, and congestive heart failure. There was 6% more mortality in those patients as compared to other people having infection and severe disease. Next slide, please. This is interesting data that published a couple years back.
I read it, about this article where acute MI, they develop after viral infection.
They look at
it came on CNN also.
It does. It did. And it was interesting finding that because of the stress of the virus, because of the inflammatory changes happening throughout the body, and especially happening to the cardiovascular system, people have more strokes, people have more heart failure, people have more arrhythmias, and in fact, the people have more chances of having heart attack after viral infection. And you can see with influenza, we have RSV there as well.
Yeah. Is it because, or tell me something, is it because of the virus affecting the heart muscle, cardiac muscles, what we call like a idiopathic myocardial syndrome or disease?
So
is it what it is, or is it something different?
There are a number of theories, and one of them is that spasms of the coronary arteries that lead to, because of the viral illness causing a lot of inflammatory changes inside, it can cause spasms of the coronary arteries, and that can cause the acute MI, which is acute myocardial infection and heart attack. Also, increase in arrhythmia leads to thrombogenesis, which is the development of those plaques and those clots that can obstruct the artery, and that can lead to MI.
So basically, for our viewers to know, the viral infection like this one can affect the heart muscles in different ways, whether it affects the conduction system or the muscles, or is a site for the clot formation.
Right. And exactly, you said that. I think the other reason is that muscles that goes into inflammatory response cause myocarditis, and myocarditis can also be a risk factor for heart attack. Next slide, please. This slide tells you that not only these patients who are dealing with the disease during hospitalization. But when they looked at the data, when patients were discharged home, around 14% of patients had lost their independence and discharge.
Right, I can imagine because of the psychological.
Exactly. I mean, the muscle, weakness, the overall psychological loss they have,
Right.
their cognitive function decline, and they end up in nursing homes. And of those 14%, they noticed that 8% had ongoing loss of independence even after 6 months of hospitalization. So that's a huge burden on our community, especially older adults who are no longer be active part of the community, and they are now dependent on others. They are having cognitive decline. They are having decline in their functional status, and now they are, either bedbound or they are in nursing homes.
That affects the financial
And again,
system.
it's another burden.
Another burden.
Talk about that. There's a lot of financial burden, not only on those patients and those families, but overall on the community and the health system itself. That's why we want to talk about the disease and tell our viewers that we are having such a hard time when we see people go through common colds. Most of the time people are okay, but anyone who is younger than a year or anyone who is older than 60-year-old,
or senior citizens,
we can see a severe disease. So with all that in mind, there's a lot of work going on vaccination, preventive vaccination. And it's been going on for years and years. But now, in last few years, there's more breakthrough, inventions. And with that, FC protein we see on the envelope is causing more and more, has more immunologic properties. Now we have 2 vaccines. Those has been approved by CDC and FDA this year, and those 2 vaccines are for older adults above 60 years of age. One is from GSK, which is
there are 2 names here, GSK,
RSV, and the other one is from Pfizer, RSV. Those 2 vaccines are recommended and approved for anyone who is older than 60.
Approved by FDA.
Approved by FDA, who is older than 60, then have any multiple comorbidities, who have other underlying lung conditions or other underlying medical condition. They can talk to their doctor, and then they can make a shared clinical decision to get those vaccines. Either one of those. And it's a one-time vaccine.
And then there's another one, Befortus. It's a monoclonal antibody. There's so much significant role of monoclonal antibodies. And I read a lot about this, even for the children, they are using it and the adult. But can you explain about this?
Right.
You are
the expertise. We can bring that slide now, the last slide we have. And that has more recommendations. So now how we can prevent our kids, the vaccines are for older adults, above 60. But there are 2 ways we can protect our kids from having the disease. One is if we can give mother vaccine, so pregnant female.
Last trimester of pregnancy, you can give it to the mother, right?
Right. So any mother between 32 and 36 weeks of gestation can get this vaccine. This is the one from Pfizer. RSV. This vaccine is recommended and approved by CDC and FDA, and that will prevent disease in
For 6 months, it keeps the immunity in the infant.
And infants are protected. Now, if mother did not get vaccine, or the other way of protecting our infant is by this long-acting monoclonal antibody, and that is called Befortus or Nirsevimab.
Is it
Nirsevimab.
Befortus?
Befortus. So this is a long-acting monoclonal antibody. And that can be given to children who born entering the season for RSV infection. And that can be given to anyone between 6 months and 18 months of age.
Is it
8 months
injection?
It's an injection.
It is an injection. Okay.
And that can prevent also severe respiratory
Severe
illness,
RSV.
especially the severe lower respiratory illness, which is pneumonia and bronchiolitis.
Yeah. So, before that, we didn't have all those. During my residency, we never heard about all this. It all came, and I can see that improves the mortality. Yeah. So now, lastly, can you comment on the side effects of the vaccines?
Yes, because these vaccines are new, and we want to make sure that our viewers and everyone knows about the side effects, and know that they are not causing any issues. There are common side effects like the injection site pain, some swelling,
redness,
some soreness, redness. That can happen. This is the most common side effects that has been seen in trials and that has been seen after vaccination. Some people can have a little bit of fever and a little bit of headache. And those are also side effects that can be there for just 1 or 2 days, and it subsides.
Could be with anything, right? And how about commenting a few words about the Guillain-Barré syndrome that has been reported in a few?
Right. So there were only 3 cases in Pfizer study and 3 cases in the GSK study with the neuromuscular disease that was found in those trials in older adults, and that was related to Guillain-Barré syndrome, GBS. They did mention that it was not associated with the vaccine. They did not find any direct association.
There was no documentation that this is related to the vaccine.
And they have ongoing studies further. This is looking into it. And we have only, handful of these cases, which are very small number, and we have not seen that in majority of patients. So this is something that we have to keep an eye on. This is something we are not seeing happening very commonly. Remember, and that's why I think we have to talk to our patients, make sure that we reassure them and make sure that they don't have any other history of these kind of disorders.
Remember when the COVID started, COVID-19, and then we talked about all those syndrome in ears, loss of... So all those things, they were there, but now RSV took over.
Right, exactly. And you will see, there's always a fear when any new vaccine comes.
Right,
with the COVID vaccine, there are thousands and millions of people who got vaccinated. Of course, we have very few number of cases where we have side effects, but it's not something that can generalize. It's not something that we see everywhere.
Right.
And I think still we see a lot of good benefit coming out of those vaccines that we are able to curtail down now, that pandemic. We are able to control the spread of disease, and we are seeing milder symptoms if people are having disease. So it's overall, I think it's a very good news, and overall it's a very good outcome and development we are seeing.
So during your clinical practice, you see all those patients and this and vaccine. Which one would you prefer, Moderna or the Pfizer? There's a lot of controversy. Which one?
Right.
What do you which one would you use in your clinical?
Again, there's no preference. Both vaccines have been recommended by CDC, and they both are good. Of course, you have to sit with your patient and go through their profile and see which one will best, fit them. And this is again shared clinical decision. That
Right. And also you have to see about cost. Right.
Exactly.
One of them might be more expensive than the other one.
Based on their insurance
What they can afford. Yeah. But FDA has approved both of these, right?
They both are in the market, and
and both of them are available through your
emergency use authorization is there for both of them.
So lastly, give us some preventative measures, because we are all suffering from flu every day. My children, grandchildren, they come up sneezing, cold, cough. So what do you do? How do you prevent all this, this? I had cough lingering for a long time myself.
So, the vaccine is the good news, as I said, that people, if they get vaccinated, I think we can curve down the big epidemic and spread of the disease, and also we can decrease the symptoms, severe symptoms of the disease. The other prevention is always going to help is that we saw and we have proof that helped in COVID, era as well. Hand washing, frequent hand washing.
Hand washing. Remember, we said for 20 seconds.
Right.
All the school will have that in the bathroom everywhere.
Especially
hand washing. We are back to same now, right?
We are.
With RSV.
Especially in winter season when everyone is coughing
Closed
and sneezing.
atmosphere.
We know that RSV infection can spread through coughing, through sneezing,
Right, through the
direct
droplets.
contact.
Yeah.
It's a droplet spread. So all we can do is, especially for our younger kids, infants, if you are sneezing, coughing, try not to kiss them, try not to have it touch them on the face, because it's usually go from hands to the face and nose and mouth, and that's how they get this disease. So frequent hand washing, make sure that you when take care of infants, you take all the preventive measures. I think that's going to help a lot.
Yeah.
In public, in crowds, if you wear mask, if you have any especially older adults, if they have any chronic disease, if they are if they have COPD or asthma, if they are oxygen dependent, I think it's better that if they are in crowds, they use masks.
Yeah, avoid the crowd situation.
And avoid the crowd. Exactly. If try not to get exposed to any sick people around them.
Avoid.
And I think that's going to help a lot.
Yeah. And before when the COVID-19 had come, Omicron viruses, I read somewhere that the virus and the doorknobs, the viruses stay for a longer time.
Exactly. That's another thing. Thank you for reminding me. Surfaces.
Any surfaces.
And the problem is, if you go to daycares, if you are taking care of younger kids, they touch everything. They go everywhere. So, kind of disinfecting all the surfaces, especially the desks and chairs and doorknobs, and everyone is frequently
in the bathroom. There's the same.
Bathrooms, exactly. So disinfecting those surfaces.
Yes,
also
very
help a lot.
important.
It's important to take care of those surfaces.
26.
The other important data they had was about use of cell phones and mobile devices.
I was going to ask you, tell us, everybody, their uncle have their cell phone.
I think that there are a number of studies that came out in the last 3 years, especially because of the COVID and spread of the COVID. And
cell phones.
It has been, described that especially viruses has been spreading through these devices a lot more than anything else nowadays.
Right.
And we can see, as you said, everyone has one.
Everybody
and everyone has one in their hands,
and
it goes from adults' hands to younger kids' hands, and then come back around. So, making sure that you clean those surfaces, making sure you
that the cell phone
clean
is clean
devices
also,
all the time. Maybe when you put them on charge at night. Clean them, or first thing in the morning when you use them. One more thing I want to add is that this virus, RSV virus, can come back year after year after year in the same person. So the immunity disappears with time. So there are reinfections happening. So it's not like that one person get it 1 year and they are immune, they're not going to get it again.
Right.
And I think that's why the importance of vaccine is there.
So
that once
in other words, you're saying they have this low resistance, right, to that, to fight the infection?
Exactly.
Okay.
Immunity disappear with time, so that you are again open for the infection and can catch the infection next year or next season. Thank
you, Rosa, for coming to my show. I like to thank our viewers for watching me on this show with Dr. Rushdah Malik, and she's an infectious disease practitioner. We want to wish each and every one of our listeners and people around in the community to have a safe winter and upcoming spring, right?